Mr. Zach?
Yes, Suzy?
I don't feel too good.
Oh, yeah? Aren't you diabetic?
Yeah, I was.
Oh, yeah. So have you checked your blood sugar level?
I haven't, no.
Oh, okay. So probably I will have to get you to the school nurse, and then we can see, we can measure your blood sugar and see how you're doing, okay?
Okay. My head hurts.
Mr. Zach, can I tell you something?
Yes, Brittany, you can hear me.
I feel sad all the time. I don't know what's wrong with me.
Oh, Brittany, we all feel sad sometimes, you know. It's just a phase, so...
But
You'll just feel better when you make friends, you know. So you just have to keep your head up and just make friends and be happy.
Okay.
So one thing is that if you start purely from a culture point of view, the mental health issues are not well accepted or recognized in the community. That definitely is a fact, and there's a significant denial that somebody in the family, a child or an elder person, has those kind of issues. Now, what are the reasons? There are multiple. One, back home, if we look at from India or Pakistan, the mental health, the concept of mental health is kind of non-existent. It is only very recently people have started talking more openly. Before that, anybody had any issues with the mental health, he or she would be considered that he is insane or he's like mentally, and there'll be a total isolation for that person, assuming that he's mad. Like that's the general. So people don't even talk about, or even if there are issues, nobody wants to go to a doctor or do anything. So I think one of the responsibility on the government is to make our mental health treatment system more humane, because I believe at this point, the way our system is also treating these individuals with mental health issues is very inhumane, and how they are treated by the system, that is one of the contributing factors for communities not accessing these services. So I think in this case, to me, more than just saying that there's any inequity, I would say that it's the community is not ready. A lot of communities are not ready, and so first the system should improve. First of all, as I said, the system should improve, and it should have a lot more openness where people are willing to explore that what it is, how it can benefit, and then you can talk about inequities and everything else and why certain communities are not availing it. I believe at this point it's a lot more deliberate that they don't want to avail these services based on what they know about the system or how it's presented. So I think that's what I will say at this point.
70% of mental health problems have their onset during childhood or adolescence, affecting daily functioning at home and school. It is important to distinguish and address the diagnosis of mental health issues or behavioral issues within this aggregate group.
Teachers and parents could potentially lack the knowledge of identifying mental health issues as they present in children. For instance, within the aggregate of middle-aged school children, the prevalence of manifestations could present as disruptive behavior rather than the underlying symptoms of mental illness.
Okay, so let's elaborate more on the challenges presented within a school setting.
Uneducated teachers may send children to the office when behavioral problems present as anger issues, attention-seeking behaviors, or hyperactivity behavior.
A child lashing out may be labeled as having behavioral issues, when in reality, they're just displaying aggression in relation to depressed feelings.
What is misunderstood is children have different ways of coping with certain situations and display feelings differently than adults.
The fact that there is a lack of resources, awareness, and support regarding children with underlying symptoms of mental illness can lead to potential mistreatment. An issue we have noticed within our aggregate group is that there is a single guidance counselor shared among several schools. limiting children's access to educated professionals able in identifying mental health. Students seek a consistent individual to confide in, but because they don't have this, they are resorting back to the incompetent professionals.
A solution would be to refer teachers and parents to seminars that would educate them on recognizing the symptoms of mental illness and what they could do about it. As a result, early detection can help treat the negative behaviors of children and get them the support they need.
One of the biggest factors affecting health and mental health is income, especially in the youth population. Income dictates what we can eat, where we go to school, and where we play. In the 2001 Canadian census, people in high-income areas generally rated their health as very good or excellent and had more time for leisure activities. The youth population living in lower-income areas face greater challenges accessing healthcare and healthcare services, especially for mental health services. One study found that an inability for a family to adequately provide for their children is highly associated with emotional health problems such as stress and anxiety in the youth population.
Children in low-income communities are highly afflicted with problems like substance abuse and violence, and the lack of resources to address these problems makes the problems even more complicated. And another study found out that problems like stress, anxiety, and violence in low-income communities are almost 4 times the normal rate.
Income plays a big role in every aspect, I think, of the lives of young people, of their families, of children in the community. Low income often means that that families are unable to sort of provide for their basic needs, whether it be food, whether it be shelter, whether it be those things. And so what happens, or what could happen, with low income is that young people seek out other ways to get funds, to make money, to meet their needs. If a young person is a part of a family who doesn't have enough money to have a fridge of groceries, then they may resort to stealing some food or seeking out other ways to get that. They may use food banks, they may use soup kitchens, things like that. Relating to the food piece, if young people aren't well fed, then we know that impacts school performance, it impacts behavior, and all of those things also then impact mental health and their ability to function and be successful in their later years, I guess.
Yeah, definitely. What do you see as positive aspects of the community? What resources do they have?
There's a lot of positives in this community, specifically in the sort of Weston Mount Dennis area. Although there is a lack of resources around here, we have some really engaged and resilient young people who have been dealt some hands that are not necessarily the best hands to be dealt, but they're still strong. They're still in support of their community. They know what they want and need to make their community better. We've got a lot of vocal young people, a lot of vocal adults and families who really speak up for the issues and concerns in the neighborhood, in the community, and although they're lacking resources, the community has had to be very resourceful in getting what they need and those pieces.
Is there stigmatization towards youth and mental illness?
I would say certainly. There's a lot of high schools in the area who are coming up with Stop the Stigma campaigns, because I think that people are really realizing that I think there's a lot of fear in misunderstanding, and when people don't really understand what's happening for people inside, their thoughts, any of those things, those mental health pieces, that it really scares people. Some people may not know how to help. Some people may not know how to verbalize these things. So I think that there is a fear in the things that we misunderstand, and that certainly contributes a lot to mental health. I think that there's definitely less of a stigma than there used to be, even in the last 5 years. There is still a stigma, but with larger sort of campaigns like like the Bell Mental Health, Speak Up, or those types of initiatives that are really, really trying to fight those stigmas. But unfortunately, yes, and stigmas also show up in different ways. There are more sort of culturally specific stigmas about people admitting that they're struggling with something and seeking out support. So stigma sort of shows up in a lot of different ways. it's still out there and there's still a lot of work to do, but that's not to discount the hard work that has been done to sort of stop the stigma for young people in, you know, creating them as leaders in their communities and speaking to their peers about that sort of stuff. So yes, there is, but I think that it's less than there used to be. And I think that we're taking the right steps to sort of diminish or to help others to understand a little bit better.
Okay, so definitely moving in the right direction.
I think so, yeah, for sure.
In CAMH statistics, 70% of mental health illnesses actually begin occurring within the childhood and adolescent periods. That being said, it is important for clients to have these social support networks available so that they can have a better chance at gaining a full recovery or to a higher quality of life if that's not possible. The reason that it's important that we have these social support networks available to these clients is due to the interdependent nature of the social determinants of health. That being said, what we would like to do is we would like to change to create public policy in order to have the resources available to create these social support networks.
The social environment is a determinant of health that is very important for the school-aged kids' mental development. School-aged children are at an age where they're developing life skills necessary for the rest of their lives, such as coping strategies and social interactions, so it's very important that their environment is supportive of that development. So at this school for developmentally delayed kids, both the social and the physical environment are crafted to suit the needs of children with mental health issues, such as developmental delays, aggression, and learning disabilities. So for an example of this is that we have a very high staff to student ratio at this school, which means that all the kids have maximal interaction with their mentors, such as their teachers and the support staff that are here. And this helps the support staff develop strong bonds with the kids, and it helps them learn what are troubling them, and this is crucial in identifying issues such as depression, anxiety, and the root of it before it develops into adulthood. The staff here are really great because they're always available to talk. They're very friendly and they're very educated and experienced in how to deal with children with everything from autism to aggression to Down syndrome. And this helps because when the kids do have an issue related to their mental disability, the staff here know how to handle that. In addition, the school also offers events such as dances and carnivals, and this just helps to facilitate interaction from student to student, and this helps create bonds between the students themselves and create that environment of community and acceptance in the school.
A child's physical environment impacts their mental health. Sir William Osler High School is a specialized high school that focuses on children with learning disabilities. The entire school is fully wheelchair accessible with large classrooms so that the children are not only able to do their classroom work but are able to do activities and to relax if needed. The high school is also privileged to be equipped with a snoozing room. The snoozing room provides sensory stimuli such as auditory, visual, and tactile stimuli. The intervention goal is to provide relaxation and activities in a safe environment. Snoozing rooms are offered around the world for those with mental illnesses or a learning disability.
The school provides a great social and physical environment for the kids to grow and develop, but what the issue is for these kids and many other kids with mental health issues is what happens when they step out of the classroom and out of these supportive environments into the real world, where society itself, we are not fully aware of mental health issues and aware of how to deal with them when we see them. So we don't really know what to do when we see a child having a temper tantrum or a teenager alone on a sidewalk crying, and we often ignore these issues and just walk by. And by doing that, we are missing what Jean Watson, who is a nursing theorist, calls a caring moment, which is any moment where there is an opportunity to provide care, whether it be as small as sitting with that child and talking to them and asking them to tell you their story, to actually helping them facilitate and organize treatments to ensure that their issues do not progress any further. We as society need to focus on grasping these caring moments and ensuring that they don't slip past our hands, because grasping the caring moments and utilizing them is a great way to create that supportive environment in not only the school, and all of society, so that youth with mental health issues and children with mental health issues feel that they have a place to go and people to turn to when needed. Here is what happens when a caring moment is not passed.
Mr. Zach, can I tell you something?
Yes, briefly.
I think something's wrong with me. I feel sad all the time.
Yeah, what happened?
I don't know, I just feel like I shouldn't even get out of bed most of the time.
Oh yeah? And that's happening frequently?
Yeah, like every day.
Oh, so have you talked to your school nurse lately?
No.
So I think we should take you to the school nurse and see what's going on. Do you think
Okay.
that's okay?
Yeah.
Okay, so we can go now.